Hi, my name is Nina Livingston. I'm a child abuse pediatrician, and I direct the Division of Child Abuse Pediatrics at Connecticut Children's.
Hi, my name is Ashley Starr-Frechette. I am the Director of Health Professional Outreach at the Connecticut Coalition Against Domestic Violence. We are the state's leading voice for survivors and the agencies that serve them.
CUES is a model to provide universal education to caregivers about domestic violence, and this is very easy to integrate into pediatric practice. We're using these information cards that Futures Without Violence provides for free. This one that we chose is called Healthy Moms, Happy Kids, but these are cards that fold out, have a bunch of information about healthy and unhealthy relationships, and we have the contact information for our state coalition printed on the back. So we're using these cards during the visit to briefly provide education. We're saying a brief framing statement, telling them that we give everyone the card and why, and moving on. And we found that this is very easy to integrate, is not taking a lot of time, and has been very well accepted by the patients. In terms of why it's important, it's because families are going to be very hesitant to disclose domestic violence in a pediatric setting for fear of being judged, for fear of Child Protective Services reporting, and maybe even for fear of the other caregiver, who could be the abuser, accessing the record of the child and creating a safety problem for them. So there's so many barriers to disclosure, and universal education gets around that by allowing you to just provide the information directly to the families without requiring any disclosure.
CUES takes away that pressure of thinking that you have to have a disclosure. This way, at least you know that every single person that leaves your office will have a resource on where to turn if those days do get bad. So it's just a really great resource that provides universal education no matter what.
After we piloted CUES in our own clinic, we looked for ways to engage other pediatricians in our state in implementing CUES in their practice. And what we did was to make a quality improvement project focused on implementation of CUES, and we provided MOC4 credit, which is quality improvement credits that we need as pediatricians in order to maintain our board certification. So we provided MOC4 credit. We created a 6-month project in which we helped pediatricians to implement this in practice and had monthly meetings to troubleshoot, provide support, and discuss the data.
This collaboration has allowed us to initially have an educational training between myself and Dr. Nina Livingston for pediatricians through our state AAP chapter, which is a great way to get people to understand why CUES might be important within this area. And then we've also worked with Dr. Livingston as she piloted CUES within her area of the hospital.
The biggest challenge is really just engaging pediatricians in this work and helping them recognize that this is our work as pediatricians, and we all need to be engaged at some level in providing these resources to families. Once we got engagement of the pediatricians in our project, we had overwhelmingly positive response, and really the experience we had validated that this is an intervention that's fast and easy and was well accepted both by the providers and the patients.
Interestingly enough, it turned out that one of our biggest problems when we were trying to implement this project was just remembering to give that card, because it was something new that was added to a really busy process. But we took each pediatrician's individual concerns around this or questions, and we worked together as a team each meeting to come up with different ideas and ways to make this easier. And by the end of the project, it seemed like it was much easier and really didn't seem to be much of a problem anymore.
My advice to pediatricians is just to reach out to your local or state domestic violence organization. They will guide you on the path. Then start putting up tear sheets in your exam rooms and your bathrooms, and don't be afraid to implement universal education in your practice. My experience is that patients have had an overwhelmingly positive response to this intervention, most saying thank you, and many saying something like, "I wish someone had given me this information 10 years ago."
My advice for domestic violence organizations would be to reach out and find a pediatrician that is willing to be that champion, to take on this role, who feels passionate about this topic, and utilize that individual to create some meetings, get to know each other, and bounce ideas off each other. Making monthly meetings can really help to make that collaborative effort really seamless and beneficial to everyone.